Bladeless and bloodless, radiofrequency-assisted excision of an eyelid kissing nevus. Nevi are pigmented benign lesions derived from melanocytes. The origin of nevus begins with the migration of melanocytes or Schwann cells, which are of neuroectodermal origin during the embryological fusion of the eyelids at the 9th week of gestation. Melanoblasts originate from the neural crest and migrate during 12 to 14 weeks of gestation to colonize the epidermis. Depending on their site of proliferation, the nevi are divided into three categories: junctional, intradermal, and compound. A junctional nevus is located at the junction of epidermis and dermis and presents as a flat, well-circumscribed lesion. An intradermal nevus, as the name suggests, is present intradermally. In the eyelid, it generally presents as an elevated lesion. The most common type of nevus is the compound nevus, which possesses the features of both junctional and intradermal nevus. Intradermal and compound nevus carry minimal malignant potential. Kissing nevus is a rare and special type of nevus with the pigmentation distributed symmetrically over both upper and lower eyelids. Also known as divided nevi, panda nevi, or split ocular nevi, it generally affects the eyelid margin, mucocutaneous junction, and conjunctival mucosa. Kissing nevus of the eyelid often poses a cosmetic blemish due to its size and location, and occasionally it may cause functional problems like blepharotosis, ectropion, amblyopia, and epiphora. The risk of malignant transformation is up to 4.5% during a 30-year period. These are conventionally managed by epidermal stripping or stage surgical excision with reconstruction using a skin graft or a myocutaneous flap, but the resultant suboptimal cosmetic appearance continues to pose a problem. In addition, the involvement of caruncle, punctum, and medial or lateral canthus makes the reconstructive procedure more complex. We introduce a new simple surgical approach with high-frequency radio wave electrosurgery using a fine needle electrode to excise and completely vaporize an eyelid kissing nevus without the need for a reconstructive procedure. A 16-year-old female presented with a pigmented mass in the left eye since birth with a history of gradual progression in size. The cosmetic appearance was the chief complaint, and clinical examination confirmed an eyelid kissing nevus left eye. She was planned for a radiofrequency-assisted excision of the lesion. Under aseptic precautions, the eye was painted and draped. Monopolar radiofrequency probe was used to vaporize the lesion layer by layer. Debris was cleared periodically. The base of the lesion was reached until the hair follicles were visualized. The hair follicles were preserved to allow the eyelash to regrow in their normal anatomical position. The larger lower lid lesion was partially excised using the monopolar radiofrequency probe and sent for histopathological analysis. All pigmented tissue was then cleared layer by layer to avoid any focal blotchy recurrence of the lesion. Thus, complete excision of the mass was achieved by a bloodless technique. Advantages of this technique include the avoidance of any reconstructive procedure, avoidance of sacrifice of any normal eyelid tissue, thus maintaining the structural and functional integrity of the eyelid, early postoperative recovery with minimal morbidity, avoidance of use of sutures and all the suture-related complications, and preservation of normal eyelash growth with minimal scar tissue. On post-operative day 1, the patient was very comfortable with an extremely satisfactory cosmetic outcome. In conclusion, appropriate utilization of radiofrequency device can help preserve normal architecture of the eyelids. This also reduces post-operative discomfort, accelerates recovery, and minimizes tissue scarring. We welcome you to the era of bladeless and bloodless oculoplasty and reconstructive surgery.